Hello, this is Dr. Michael Greger coming to you live from my treadmill, as I do every month, to answer any questions you may have. For those of you unfamiliar with my work, every year I read through every issue of every English language nutrition journal in the world. So busy folks like you don't have to. I then compile the most interesting, most groundbreaking, the most practical findings into new videos and articles I upload every day to my nonprofit site, nutritionfacts.org. Everything on the website is free. There are no ads, no corporate sponsorships, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love, as a tribute to my grandmother, whose own life was saved with evidence-based nutrition. Before I get to your questions, which are already piling up, I want to announce that I have a webinar coming up next week, next Friday, on the best diet for thyroid function. I'm going to be talking about hyperthyroidism and as well as hypothyroidism, including Hashimoto's thyroiditis, so both overactive and underactive thyroid issues, and what we can do from a dietary standpoint. You can register by going to nutritionfacts.org/webinars. All right, let's get to your questions. Okay, let me go up to the first one on the list, and that is Maria asks, is it possible for an 84-year-old to have high blood pressure? Of course. Oh, on a high whole food plant-based diet and low salt take? Yes, indeed. There's all sorts of things that can increase your blood pressure, and just because a crappy diet, which includes a high sodium diet, is the number one cause, there can be kidney issues, there can be issues with the arteries that run to the kidneys, all sorts of reasons. You can have high blood pressure, and indeed it can be a drug side effect. So they need to work with their physician to find out what the cause is, so you can treat the cause. Though typically a whole food plant-based diet is very effective in lowering blood pressure. And I have a video on that, and I go through all the different ways, lifestyle ways you can decrease blood pressure. In fact, I compare different ways of eating to fasting to blood pressure medications. It's actually one of my most recent blood pressure videos. And in fact, I could search for it really quick and put up the URL, but you should be able to find it by going to nutritionfacts.org. Okay, next up on the list is Chev Weeze, who says, do high omega-3 oils for skincare provide similar benefits to ingestion, or is there no effect topically? I'm actually doing so the answer is I don't know what the impact of putting omega-3 rich oils on your skin is. I'm doing a whole chapter on skin, on aging skin, though, in my new upcoming book, How Not to Age. So I'm going to talk about wrinkles, talk about varicose veins, talking about skincare in general. And so I'm sure there'll be lots of stuff on both topical things as well as healthy skin from the inside out through diet. So stay tuned, and I'll let you know. Okay, Cynthia says, hello, I'm 26, and have had liver disease. Do you have any advice for me? Absolutely. This is a disease that can be prevented, arrested, even reversed with a healthy enough diet and lifestyle. So I'd encourage you to go to nutritionfacts.org and type in fatty liver disease, which is now, I believe, the leading cause of liver failure or need for liver transplant. And so, check out Nutrition Facts. I've got a whole bunch of videos. And in fact, I think I have a few more videos coming up. So stay tuned. Maria says, is mallow okay to eat in a large amount? I don't know what mallow is. If you're talking about marshmallows, no. Maybe you're talking about marrow, like inside of the bones? I don't know. Please clarify what mallow is, and I'll try to answer your question. Vladimir says, don't I miss okara in store-bought soy milk and tofu? Could we consider them as whole foods? Yeah, so it's neat when you make soy milk, meaning you take like soybeans and you whiz in a blender with some water. This really cool skin forms on the top that you can use for all sorts of kind of culinary things. But they skim it off when they for commercial soy milk. But are they considered whole foods? No, of course they're not whole foods, because you take the whole soybean, and anytime you fraction it into anything, whether milk or anything else, and not only that, you take all the pulp out. You strain the pulp. So when you strain the pulp, then the skin forms on top. All that pulp, that's where all the fiber is, lots of polyphenols, lots of wonderful things. So not whole foods, but I mean, so it's a yellow light food. It's a processed plant food. So always better to eat whole soy foods like edamame, for example, the immature green pods. In fact, I've been buying them frozen a lot. Super easy. Get these bags and you rip them open, put them in the microwave or air fry them. And basically just till they melt. And you don't want to get them too dry because you want to sprinkle all sorts of seasoning on them and have a little moisture on there so they stick. So what I've been doing, I've been sprinkling on nutritional yeast and garlic powder, onion powder, smoked paprika, little chipotle pepper powder. What else? The Table Tasty stuff, which is salt substitute, Benson's Table Tasty. A little expensive, but totally worth it in my estimation. Yeah, I think that's it. Sprinkle that on. Oh, put a little Tabasco on, and then just just eat them out of the pods. They're super fun to eat. That's probably my favorite whole soy food. You can get soybeans, you can, whatever. Anyway, all right, lots of it's probably more than you wanted to know, but I'm just something I've been eating a lot lately. Okay. Oh, Mark looks like he's just replying to somebody else. Let me go on to the next one. Raz says, "Is it matter how much sodium is in miso?" Oh yeah. And is whole grain matza healthy? Okay, great questions. I actually have a video about miso. So there's 3 reasons that we're concerned about high sodium. Primarily, high blood pressure, stomach cancer. What was the third one? High blood pressure, stomach cancer. Blood pressure, stomach cancer. Yeah, well, let's go with those 2. And so you would assume that people eat a lot of miso, which is just packed with sodium, would have high rates of stomach cancer and high rates of high blood pressure and associated strokes that go along with high blood pressure. But it turns out people that there's a study done in Japan, and high miso eaters were like people eating 3 bowls a day, did not have higher levels of high blood pressure related diseases, nor stomach cancer. And so the thought was maybe the protective elements of soy were somehow counterbalancing the negative effects of sodium. Who knows? But miso can be considered a green light food because it's a whole soy food and does not seem to be associated with the negative effects we normally see with high sodium foods. So it's a way to make things salty without adding salt, or at least without adding salt in a way that would be damaging from a blood pressure or stomach cancer standpoint. Okay, Erica asked, how concerned should I be? Oh, and that wasn't the next one. They're kind of scrolling up so quickly, I just kind of click randomly. So sorry if your question was next and I missed it. Ask it again and maybe it'll come up in the queue. Erica, how concerned should I be if my HDL is low with low LDL levels? You shouldn't be concerned at all. Why? Because HDL is no longer considered to have a role in terms of a risk factor that's a cause and effect risk factor. So I think it's in my, there's an egg video about HDL. I think that's the one where I talk about all the new science about HDL. So we used to think that having high HDL was good. Until we started doing, because indeed high HDL is associated with all sorts of beneficial things like low rates of heart disease. So hey, let's raise our HDL. Okay. But it turns out that all sorts of different drugs working all sorts of different ways to increase your HDL don't work in terms of lowering blood pressure. And of course, one of the reasons we know LDL is a causal risk factor is because any number of drugs that lower your LDL by any means lower risk of heart attacks and death. But it didn't work the HDL. And then they do these so-called Mendelian randomization studies where basically some people are just born with really high HDL levels, regardless of what they eat, regardless how much they exercise, regardless how much alcohol they drink, or really low HDL. And it turns out it doesn't seem to make any difference. Whereas with LDL, you're born with high LDL levels. Regardless of what you eat, you die prematurely. And if you're born with really low, then you have this so-called PCSK9 inhibitor mutations. That's a fantastic thing because regardless of what you eat, you live a really long time and low rates of heart disease. And so that's another one of the reasons why we know LDL is a causal risk factor, but HDL does not appear to be a causal risk factor. So I think in the video I talk about how HDL is like ashtrays or gym shoes. So it turns out there's a really tight correlation between, presumably, between the number of ashtrays people have in their house and their, rates of, lung cancer. And so what we should do is get rid of people's, lower people's ashtrays, have them go from 3 to 2 ashtrays, right? Of course, that's ridiculous because, ashtrays is not the causal risk factor. Yes, there's a very tight correlation, but change the number of ashtrays is going to help you. Same thing with gym shoes. People have lots of gym shoes, probably live longer, but it's not because of the gym shoes. That's not the causal risk factor. You can't just have a whole bunch of gym shoes in your closet and expect to live longer. That's the difference between kind of a associated variable and a causal risk factor. And the reason that difference is important because we want to know if it's causal because we want to know if we should actually try to change it. So don't worry about your HDL in the context of low LDL. Okay, anyway. Any suggestions for a 20-month-old who isn't gaining weight and is being recommended dairy-based supplementation? You need to find a pediatrician, a dietitian, that will work with you to gain weight in a more healthful manner. And of course, there's lots of non-dairy nutritional supplements on the market now. The question would be exactly what is it that the kid isn't getting enough of? Is it a matter of calorie intake? There's just healthier ways to do it. And if your doctor has no clue how to do that, then you need to find a better doctor. Okay, Nelson asks, can anyone help an enlarged aorta, possibly with Marfan syndrome? Marfan syndrome is a genetic disorder, which can shorten one's lifespan due to problems with the large artery that goes out of the body. You can't change the genetics, at least so far, but one can make sure one doesn't have high blood pressure, etc. That can lower one's risk of having negative outcomes, but you can't actually change the structure until we have gene therapy. April, May, June asks, happy Friday Eve, I guess. What's the best B12 to take and what dose? Also, how do you reduce for a BMI fast? I'm not sure what that means, but the best B12 is cyanocobalamin because it's most stable at room temperature, stable in supplemental form, and there's the most data showing how safe and effective it is. And how much should you take? I have recommendations. In fact, I don't know if this is really going to help people, but I can post a link. Dun, dun, dun. Here is the link. Wow, that's a long link. Sorry about that. If you just type in optimum nutrition recommendations into nutritionfacts.org, you can see I started putting those up in 2011, but there is I believe 2020 update. It's the latest where I talk about how much B12 people should get. I also have a recent series of videos talking about how much B12 one should get from either supplements or B12 fortified foods, and also break it down in terms of age for young folks, as well as how much the elderly should take. Okay, let me get back to the questions. Caustic Hymn Production says it is harmful to take daily allergy medications. Ideally, we should try to not to take any medications if we can help it, if there's no better, safer option. I have not looked at the epidemiology of chronic allergy med. Nothing. I mean, I haven't just stumbled across any terrible things. That they seem quite safe drugs to me, but I have not looked at the data. So I don't know how harmful it is to take them long term, but if there's anything we do to reduce it in the first place, and I have a bunch of videos on dietary, what one can do with diet to decrease one's seasonal allergies. So if you're taking it for something like dust or mold, it might not work. But for people who have seasonal, like pollen allergies, there is some data on some things we can do through diet. I have videos about that, mostly based on cedar pollen allergies in Japan, I believe, if I remember correctly. All right. Anna says, should I take any supplements on a plant-based diet? Everybody needs a regular, reliable source of vitamin B12. Doesn't have to be in supplement form. You can take B12 fortified foods, but that's critically important. If you don't get enough sun, you may want to take some vitamin D. And one can consider, here, I will go back. Are you ready? Here are my supplement recommendations. Again, just type in optimum nutrition recommendations in nutritionfacts.org. Okay, what's next? We have Disa saying, could chronic anemia trigger an onset of sickle cell? That's a good question. I do not know if anemia, a number of stressors on the body can trigger sickle cell crises. And I don't know if that's one of them. And if it does, then obviously you need to treat the cause of the anemia. Iron deficiency anemia is one of the most common causes, but there are other causes such as losing excess blood, particularly menstruating women who have heavy periods, or your body may be chewing up your blood cells too early, or you may have a problem in your bone marrow in terms of making it. There's lots of, your doctor can do iron studies and figure out, differentiate between, find out exactly what's causing the anemia so they can treat the underlying cause. Okay, Nicole says soy formula versus cow's formula. And the question is human breast milk. And do babies need the hormones in cow's formula? Of course they don't need the hormones in cow's formula. Who needs cow hormones? Calves. Okay, yeah. Don't get me started. Next up, Jessica T asks, for a vegetable fruit wash, I recommend a 1-to-10 ratio of salt to water, but don't recommend how long you need to be in the bath for. Oh, I'm surprised I didn't in the video. It says a soak, a scrub, or a quick dip. I would have to go back and look at that study. Surprised I didn't put it in the video. But if you, under every single one of my videos, I have a sources cited section. You click on it, they have hyperlinks to all the sources I cite. So you watch the video and you see up in the upper right hand corner, the citation. You say, oh, that's the citation. Then you go click on sources cited, click on the video, and download the PDF, and you can see what protocol they used. And so I don't remember if it was just like a dunk or they actually let it sit there. Most important thing, you want to rinse it off afterwards, obviously, because you don't. Last thing we need is more sodium in our diet. Okay, Jessica Story asks, using soy formula when unable to breastfeed. I was told by a pediatrician I shouldn't use it for a baby under 6 months for dietary non-allergy reasons. Is it safe for a baby's future fertility? There's So the best formula, of course, is no formula at all. It's human breast milk. If you can't breastfeed yourself, you should contact the Leche League. And lots of women don't think they can breastfeed, can actually breastfeed. They just need proper training and counseling. And there's also human breast milk banks and all sorts of ways. There's really no substitute whatsoever. But in terms of, but there have been concerns that soy formula, was forced use formula, has these phytoestrogens which could have reproductive effects. And last time I looked at the literature, that did not seem to pan out. It's kind of a theoretical concern, but doesn't actually seem to happen out in the real world. Okay, Joe says, for how long can you keep ground flax in the fridge before getting oxidized? The absence of conclusive proof they're okay. 6 months in an airtight container. Isn't that amazing? 6 months in an airtight container on your kitchen counter. Doesn't even have to be refrigerated. That is nuts. Amazing. Whereas, of course, flaxseed oil, would oxidize in a matter of days, even kept in the fridge. So that just shows it's one of the reasons why we should eat whole foods, right? Because they come prepackaged with all the antioxidants and all the complementary nutrients that keep it from going bad. That's one of the reasons, at least. And so, yeah, isn't that remarkable? And I have a video about that if you want to actually read the paper. Wild. Okay, Mia says her husband suffers from gout. He eats mostly vegan, avoids all high purine foods, no relief. Any other tips? Water, right? So gout is caused by the uric acid crystallization. It's kind of like a rock candy. How do you make rock candy? You have a supersaturated solution of sugar, you put a little string in or something, and it forms crystals. It's too much in solution. Same thing, uric acid levels get so high in the blood that it starts crystallizing out of solution, forms these little irritating crystals, particularly in one of the big toes is characteristic. It can be super painful. So what we do, and so how is uric acid created? Uric acid is created by meat and sugar. So like fast food meal with like a burger and a soda is like the worst possible thing. Sounds like dietarily doing pretty good here. Also want to avoid alcohol. That can also increase uric acid levels. So if they're mostly vegan, avoiding high purine foods, but drinking beer, that could be a problem. So assuming that they're also avoiding alcohol, what you can do is dilute that uric acid by drinking lots of water all the time, right? Because then we're diluting it and keeping it from getting to too high concentrations in the blood. Okay. Oh, and you can also eat lots of dark green leafy vegetables to alkalize your urine. That makes the uric acid in your kidneys more soluble. And you pee more of it out. And so dark green leafy vegetables, low oxalate greens like kale and arugula or any of the cruciferous greens are wonderful. All right. What are the reasons that cause frothy urine? Well, a certain amount of froth just created for the physics of it all, but it could be a sign of something called nephrotic syndrome, where you are peeing out too much protein. Your body, the whole point of urine is to get rid of the bad stuff or excess stuff and keep all the good stuff. But if you have kidney problems, you can start actually have a protein wasting, where you start losing protein and cause all sorts of problems. And if there's enough protein in the blood, that can make it a little extra frothy. But that's an easy test. You can get your urine tested, make sure you're not using urine. But most people that complain of frothy urine, it's actually just normal and there's nothing, they're just not seeing lots of urine. And so they're just not realizing, everybody's urine kind of does this. But you can get your urine tested, make sure you're not losing protein. Okay, next up. Mia is back. Someone was complaining that I often answer the same person's multiple questions and would rather me mix it up and ask and not duplicate person's questions. And I don't know, my first kind of inclination is like, well, if the person went out of the way to write a whole bunch of questions, well, they should be rewarded by like me answering multiple questions. But all right, but some of my staff thought it might be better if I give more people a chance to answer questions. So me had already answered questions, so I'm going to skip it over and go to Raphael, who says, should we drink the juice from pickled foods? No! Oh my God, too much salt. In fact, we shouldn't eat the pickled foods. Too much salt. There's another Raphael one, so I'll mix it up. L says heme deficiency. Oh, interesting. And Alzheimer's disease. No potential carcinogen, the heme iron, but it could be essential for some people. What about porphyria patients? Why aren't I on the webinar? Vegmed Berlin21. Oh, good question. I've been on doing the Vegmed conference every year for a number of years. Must not have been able to fit into my schedule. I am going to be covering doing a deep dive into Alzheimer's and part of that will be looking at the minerals like iron, aluminum, etc. So I'll give you an update on what's happening with Alzheimer's and iron in my new book, which won't be out until December 2022, assuming that I get it done in time. Right now, oh God, I don't even want to look. Right now, I'm still in the research phase, collecting PDFs to read. And how many PDFs? We have 10,116 papers so far. Hey, all right. So I got a lot of work to do before the book comes out. All right. Joma 4 says there's a case in India in 2020 where someone on a vegan diet developed hydrocephalus. They think it was because they were not taking B12. Are familiar with the case? You think that was why? I'm not familiar with the case. So hydrocephalus, it's kind of water on the brain where you have buildup of cerebral spinal fluid. I'm not sure why they thought it was a B12 issue. I mean, that just happens. It's an issue. We're actually not sure why. I think there's some blockage in the outlet. Normally, we make cerebral spinal fluid and it gets and circulates throughout our brain, spinal cord, and then it gets kind of drains out. And then we make more, and just this nice constant flow. For some reason, there's an outlet obstruction, and it builds up. It just can't get out. And so actually what you do is you surgically install a shunt. You actually put a little tube up into the brain and then kind of tunnel it under the skin and just let it drip into the abdominal cavity. And so it releases the pressure. I've never heard of it being diet related, but you need to get your B12 for all sorts of other reasons, including for brain health. Alice, what's my recommendation for reducing water retention? The question is treat the cause. The answer is treat the cause. Why are you retaining water? So you're retaining water because you have that nephrotic syndrome because you're losing, you're losing protein in your urine, or there's all sorts of reasons that we can be retaining water. And so you need to find out what it is, and then I can help you figure out what to do with it. Do menopausal women need fat in their diet? Well, we all need the essential fats as human beings. But do we need to increase our fat intake after menopause? Not that I know of. Matt, is Dr. Avi's scientific analysis of the heart disease reversal trials on a whole food plant-based diet? That isn't a question, but for those of you who don't know, Dr. Avi is writing a paper talking about heart disease reversal on a plant-based diet. And we're all looking forward to seeing it published and seeing any reply, and I will do a video about it. Ta-da! All right, Matt, what grains/legumes are most poorly absorbed in animals, leading to poor weight growth in animals? Oh, healthy for, okay, yeah, just sorghum, or is millet better? So I just did these videos on sorghum, and it turns out there are millets that are better, but millet, as I talk about in a cooking video I have coming up in a few days, it's not actually a thing. Millet, what we call millet, is typically pearl millet, but there's dozens of different types of millet from all different plants. Millet just means small grain. It's complicated. I got videos coming out on it. It's very interesting. The bottom line, finger millet is, there's all sorts of benefits to all sorts of different millets, but finger millet's the one that I use in my new bro mixture, and the video will explain why. Unfortunately, I got another interview starting right now. Let me remind everyone once again about this thyroid webinar. Oh, there we go, thyroid webinar coming up next week, next Friday. If you want to register for it, of course, all the videos contained in that is going to be up on free and Nutrition Facts in the coming months, but you can see them all there and ask your questions live next Friday. Check it out. Have a great day, everybody.